So welcome to the podcast, Dr. Ghadir.
Thank you so much for having me, Michelle.
So can you give us a background, how you got started and interested in specializing in fertility?
Absolutely. So my name is Shahin Ghadir. I'm one of the partners at Southern California Reproductive Center in Beverly Hills, California. I've been with the group for 16 years. Before that, I had been fellowship trained at Cedars and at UCLA. And during our fellowship training, we work here at this office. I joined them the second I graduated, and I've been here the entire of my professional career. It's been a wonderful opportunity. We have one of the largest IVF centers on the West Coast of the United States. And with that, we also have one of the highest success rates and one of the most advanced IVF labs in the country that we're very proud of.
So cool. I'm excited to pick your brain today.
Absolutely. I love that.
So it's cool. I heard that you're also into acupuncture. We'll get into that in a little bit.
Yes,
combining.
I love that.
And I also have a lot of people who are going through IVF. So I find it is really, really a great, what's the word with the C? It's the end of the day for me. So it's a good, it's very compatible, but there's a word that I'm missing. Anyhow, I wanted to talk to you about something that seems to be on a lot of people's minds, which is AMH and FSH. A lot of times when I see people, they get really nervous by those numbers. I do know that there's been a study that actually shows that it doesn't really predict pregnancy outcomes. And so I do mention that to people because people get very, very nervous. So can you just talk about that, what your take is basically on the importance of those numbers?
Yeah, what I've realized is over the years, you can find a study to support whatever in the world you want it to support, and you'll be able to find another study that says the opposite.
Sure.
I have to say I think that there is some truth to AMH levels and FSH levels predicting fertility and overall how you're going to do. And overall how you're going to do has a lot to do with your pregnancy rate. And I think AMH is the #1 predictor in my eyes of how people do. When the AMH is the hormone that comes from all the eggs in the body, so the higher the AMH level, the more eggs someone has. The lower the AMH, the less eggs that person will have. It could be done on any day of the month. It doesn't have to be specific to a certain cycle day or a day of the menstrual cycle at all. So for me, it's a very important test, and I do it all the time on everyone. Now, I have had people with very low levels also get pregnant.
Right.
And we have had people with very low levels.
Please enter the.
Sorry about that. Let me just.
No worries.
We've had people also with very high levels not get pregnant. So in that way, I think it's true that it doesn't necessarily predict things. However, a solid number is much better than someone who has a very low number, because the more eggs you have, the more opportunities of a successful pregnancy you have.
Right.
So that's the AMH.
Yeah.
The FSH, on the other hand, I really do believe that is not the best test and predictor. Mm-hmm. FSH goes up and down, up and down, up and down. People are thinking the month it's lower, they do better. It could be, not necessarily. Mm-hmm. And I have seen that the higher and higher the FSH goes, people do worse and worse. But we've also had people with FSHs that were in the 20s on day 2 or 3 of their cycle still get pregnant. So we've seen it all.
Yeah, that's actually great for people to hear, I'm sure, because people get really, really upset by it. And what I've actually found was I had one patient who got tested twice in a day because she had a gynecologist appointment, and she also saw her reproductive endocrinologist, and she just got 2 labs that same day. And within those two in the same day, they both fluctuated.
Wow. You know what? That's the absolute truth, though. Was that the FSH or the AMH?
The FSH.
Yeah, FSH goes up and down a lot.
Yeah.
I have to say, I do think that the AMH, there's some level of consistency to it. So that's why I think it's a more accurate test.
Right. And another question is, I have seen that go up and down as well, the AMH. I have heard, now it's not something that I really, really looked deep into, but I've heard that there's some research and thought behind the fact that women may end up having more eggs than what they were just born with, like meaning that they can create more. This is like a new thing that has come out. Because the idea before that is that women are born with all the eggs that they'll ever have. So I wanted to see if you heard anything about that.
Correct. I have not. To the best of my knowledge, from the day that I started this career line and this path, the number of eggs you had were solid. Every month when you ovulate, you have about 1,000 that die off during that process of apoptosis.
Mm-hmm.
And the older and older you get, in order to release that one egg, your body has to try so much harder and harder. It just goes up to more than 1,000, more, up to like up to 2,000 eggs a month can die off.
Mm-hmm. Yeah, I got to look more into it, but I have heard it from a really good source. So I have to definitely look into it. Yeah.
For everyone's sake, I hope there's truth to it. But if that's the case, then I'm assuming then no one necessarily should be going into menopause.
Well, I mean, people can push it back. You know, eventually everybody does, because your body just gets tired in general. But there may still be a fluctuation. You never know. You never know. Things do come out. You know, you never know. We do get to certain points in science, and then we learn other things. So
yeah, we do.
For sure. So another thing that I've also been hearing many different opinions on is low stim IVF or mini IVF. Some people say that even though it produces less numbers, the quality may be better. And then some people say, some people actually don't really do well with high stimulation.
I think there's a lot of truth to that.
Mm-hmm.
So I haven't used a very high dose stimulation protocol in probably over 5 years.
Mm-hmm.
Studies came out that showed very high doses of stimulation overly saturate your pituitary receptors, and
Mm-hmm.
they just stop functioning and responding. When that study came out, I had a particular patient of mine that was barely responding and making eggs. When we went ahead and cut her doses to half, she started to respond. And actually, in a matter of 4 cycles, we had 10 genetically normal embryos that she made.
Wow,
which
that's
was
incredible.
unbelievable.
It is
and if I wouldn't have done this myself, I wouldn't have believed it. So I have cut my doses of medication significantly for most of my patients. And then I also have noticed that some of my older patients that do have very low AMH, I think their body is more sensitive to a response with low dose. Now, when people say a mini dose, I think a mini dose gets to the point of being wasteful. And doing IVF, just taking a Clomid pill or barely any medication or going after that one egg, I think is a little bit of a waste of time. Unless your body only makes one egg at a time, and even with all the medication in the world, you're only doing one, then I think it's worth it to go for the one. But I think a solid but low dose is the best route for someone who doesn't respond to the normal doses. And again, I never do the really high doses, so I can't respond to that. But when I used to, and when everyone used to do that, I don't think I had better responses and better outcomes at all.
When you used to overstimulate or stimulate
not overstimulate, but we used to give like doses that got into like, about like 650 ampules and or units a day. I just don't feel like anyone needs things like that anymore.
Yeah. And the mini IVF, so when you're talking about just the one or using just Clomid, but then there's this one that's in between where they use the natural cycle of the woman. That's what I'm talking about.
Are you talking about when you're just going after that one egg a month that they're releasing? And
no, not just
egg?
One. They do a couple. It does get a couple, but it's just a lower dose.
I'm not a believer of the medications harming. So I think just doing an entire IVF cycle and all of the fees and everything that goes along with the genetics and everything just for 1 or 2 eggs is not ideal. I can understand if you can't make more than that, but I think just a solid dose of medicine that is well established for your body and for your hormones, I think is probably, in my opinion, the best protocol.
Right.
But definitely not a fan of very high doses. And I see people coming to me from other clinics all the time that got really high doses.
Yeah, and then some people get overstimulated, which is definitely not good. I definitely makes a lot of sense what you're saying, because I do think that the body responds, but not when it's overwhelmed.
Correct.
So yeah, we'll talk about prescribing acupuncture. I really love, I've been to transfers before and after, and I think it seems to work really, really well.
I love acupuncture. I think it's great.
Yeah, and so I wanted to get what it's interesting to me to kind of pick your brain and see what you've seen with between patients that haven't done it or the combination and how you perceive it as helping.
So I think that acupuncture is great for the right person.
Hmm.
I have asked patients, that I can talk about my own experience. I have a couple acupuncturists that I love, and whenever I've gone to them, I've fallen asleep. I woke up completely reset, rejuvenated, and a brand new person. And I walk out of there feeling amazing. I also have patients that have gone to acupuncturists where they didn't have that feeling.
Yeah.
It was all about buying supplements and doing things that made them feel uncomfortable
Hmm.
and getting in needles that made them very nervous
Hmm.
and people that did not, necessarily calm them down. And I think for someone like that, it's actually detrimental. So
Yeah.
for the majority of people, they go to good acupuncturists that are a very big support system during their IVF cycle and are loving and caring and give that extra TLC and extra care that they need and anyone can use, and doing the right acupuncture, which increases blood flow, I think could be amazing and can
Yeah.
be very, very helpful. So 95% of my patients, I think, benefit significantly from that deep relaxation that it brings upon during a time of significant stress. And I think that it could definitely, that putting the body into that level of relaxation can help significantly improve outcomes.
And have you done they call it the Paulus protocol before and after transfer?
So we do that a lot. So we recommend it for patients, and we offer that for patients to do it. Not every patient does it, as you
Mhm.
know, and everyone
Yeah.
knows. Unfortunately, IVF is rather expensive,
Hmm.
and if you're doing this on a really tight budget, spending extra on additional services can be difficult for some. But many people in our practice do it. We are actually bringing a full-time acupuncturist into our
Oh,
practice
that's
very
great.
soon. Where are
Awesome.
you located, Michelle?
Miami Beach.
Oh, wow, nice. A little
All
too
the way
far for you to
amazing.
come here every
A
day.
little too far, for sure. But yeah, I actually am in touch with a few reproductive endocrinologists. I love working with them because for me, it's a great compliment. That was the word. I knew that C word. It's a
Compliment. It was
great
like, you're right, it's a great
compliment.
compliment.
Yes.
They're
Um,
complementary to each other, and it's
mhm.
yes.
There you go. I found the word finally. It's late in the day for me. So I've become a morning person. I used to be a night person, but I've become a morning person. I could definitely tell the difference. So as far as supplements go, do you guys, because I know some places, everybody has different perspectives. Some places have a list of supplements that they give their patients. What are your thoughts on that? And
So I am more than happy to give supplements that we start off with. So we put everyone on prenatals. The one I use is gluten-free. It's vegetarian. I give an omega-3 that's plant-based, not fish-based, to avoid any kind of mercury buildup. I love CoQ10, the pure form ubiquinol.
Mhm.
We recommend to almost everyone at 600 milligrams a day for the women and 200 for men. We do give DHEA for people that are low AMHs and low egg reserves. Now, the problem is that I'm not 100% familiar with Eastern medicine and what they do. So I don't necessarily prescribe the herbs unless I see that, there can't really be much of a downside.
Mhm.
Um, if someone's first cycle, they're in their mid 30s, I'd rather just not mix them together to start off
Yeah.
and see how they do.
No, I don't either. As soon as a person, supplements is different what you were mentioning before, but as soon as people start any kind of stims, I back off as far
On,
as herbs.
on everything.
No, herbs.
Oh, herbs. Okay.
Yeah, like CoQ10, things like that, prenatals,
Right.
obviously, they continue.
Well, those have been proven in studies. So that's a
Right.
little bit different for me.
Yeah, for sure. What are your thoughts about L-arginine? I know there's this back and forth on what it does with eggs and embryos versus lining.
To be very honest, I don't use it, and I
Hmm.
don't really introduce it too much in my practice. But I'd love to know what your thoughts are on it.
So basically, I've read a lot from Rebecca Fett, her book, It Starts with the Egg. It's a great book because she really
I know.
relies heavily on studies. And so it's a very good resource. She really kind of has a lot of backup studies to what she's saying. And she mentions that there's too many conflicting studies on whether it helps. Like in some studies, it helps the egg quality, and others it actually makes it worse, and it also therefore affects the embryo. And so to me, it's too questionable when it comes to egg health. So what she says is, although that's the case for women, for men, it's really good because they found L-arginine on the head of sperm. And so it's supposed to be good for sperm health, and it's also supposed to be good for uterine lining.
Well,
So she suggests it before transfer, not before retrieval.
Many amino acids are great for the sperm well-being. So lots of amino acids, as we know, are important for sperm well-being. It's been a very, very long time that we have had people with troubled linings. And thank God, I don't know why, maybe we're just on
great.
because I used to have a lot of people with bothersome linings, but I think people have gotten much better for some reason or another, and I don't know what the reason is. With that being said, anything to help the lining is helpful. But one of the things we realized for the patients that can't build that perfect 8mm trilaminar lining, which is the goal for our practice, is that I started to do transfers on people with just thinner linings, and guess what? They did great.
That's
I
great.
even remember I had a patient that
like
had
how
the
thin?
thinnest,
How thin?
I transferred someone with a 6.5 and got pregnant, and I wasn't worried anymore. And then I talked to some colleagues of mine in different clinics, and they said their guidelines was anything over 7. So our goal is over 8. But if someone cannot get there, I'm perfectly fine with anything a millimeter less than that. And if there is that rare person that just cannot build up a lining, we can even do it thinner. Now, of course, it's not ideal, but some of these people with injections of estrogen, patches of estrogen, pills of estrogen, vaginal estrogen, still can't build up a lining.
Yeah, it isn't, but it does make me feel better to let my patients know, because they get very nervous if it's not an 8. Well,
I think there's more negative aspects of being nervous.
True.
Than it being 7.5.
Yep. Well, thank you for that. I'm going to definitely mention it to my patients. So
I'm
for sure.
I'm a firm believer in your mental space and where you are mentally. I think it's as important as where you are physically.
Oh my God, that is so refreshing to hear. Not a lot of doctors say that, so I love hearing that. I'm a big firm believer in the same thing. Actually, there are some studies on that and visualization and how that can affect our body. But I agree with you 100%. And even when I speak to patients and I give them protocols on food, obviously we try to lower inflammation. I know that's huge for both sustaining pregnancy and also implantation. You want to bring down inflammation. So I work with them on food, but I say, listen, if it's going to stress you out, we need to work in a way that's with ease, because people get very stressed out by the supplements, the diet, all these protocols.
One of the things that I really, on the day of embryo transfer, when I say goodbye to my patient, I'm like, now you're going to go home and go do something really funny and watch the funniest show you've ever watched.
I love
because
that.
I do believe getting endorphins and good energy going through your body has great outcomes. And there were some studies that were done in Israel years ago when someone came into the room of an embryo transfer and they made people laugh compared to the room that someone did not go in, and they had higher success rates in the room where people were laughing.
That is so cool. Can you send me that study?
It's been years and years, but it came out of Israel.
Oh my God,
I think it was
that's awesome.
to do with a clown, but there's such good data. And you know what? There's absolutely no reason why someone should go home and get worried and not go home and relax and laugh and have a great day.
100%. I'm so I love what you're saying. I really do. I'm so excited. I'm going to be talking to my patients about that. That's definitely something I'm going to add in there, because I always talk about visualization. Just see yourself doing it. At first they get scared, and I said, well, you've gotten to this point. What do you have to lose? Just visualize it. So that's really cool. Another thing is, obviously you guys are doing a lot of state-of-the-art, the newest research. What are you most excited about? Are there new add-ons? Anything that you guys are working with?
Yeah, one of the things that we're doing, I lecture around the country, and I realized I was giving a lecture in Detroit. There was about 50 people in this restaurant where I was speaking. And when I brought up the endometrial receptivity assay, the ERA testing, which is the practice month where you check the lining of the uterus, I realized that only one person in the room did an ERA and didn't know it well. And only one other person had even heard about it. And for us, that's become very normal practice for us in our practice to do that. You know, I think it's really, really, really important to be able to understand the newest things and understand how to use them in your practice. So the endometrial lining testing, when we put a beautiful embryo in and it wouldn't implant, was just the most difficult thing in the world to understand. So we basically went ahead and we offer everyone an ERA cycle before a frozen embryo transfer. Everyone is a frozen embryo transfer. We don't do fresh transfers anymore for many different reasons.
Yeah,
and
I've heard
things
it's better.
I think have really significantly helped. We're a huge proponent, and I still can't understand clinics in the country that are doing embryo transfers on untested, genetically untested embryos still. When it's so available and it's so precise and it is so easy to do and only brings out healthy outcomes, there are still tons of clinics that don't want to do it, and they say that it could potentially damage an embryo, which it's obviously done under the wrong hands that people don't know how to biopsy well.
Right, because people do it all the time.
All the time.
Yeah. That's interesting.
This is one thing that's led to some great successes in our office is being able to do the genetic testing, being able to do the ERA, being able to, we even have a special incubator called an embryoscope, where when you put the embryo in it for the 5 to 7 days of growth, it just takes 1,000 pictures a day as it grows, and we watch it as a video at the end of the 5 days.
That's so cool.
You no longer have to even remove the embryo to do anything other than look at the photos and the videos.
That's amazing.
Yep. It's,
so this is not something that everybody has, though.
No, there's not that many of them. They're really expensive. They're a few $100,000 each machine. We have them. And the studies that were done, there was a huge meta-analysis done around the entire world about people who were using embryoscopes. And they showed that clinics that used embryoscopes, some had as high as a 20% increase in pregnancy rates.
Wow, that's incredible. That's incredible. Let me ask you a question. Do you guys work, like say somebody's where I am, do you guys work from afar? I mean, obviously you need people to be there, but
I do a lot of consultations. Yeah, absolutely. We have a lot of people coming to us from all over the country. So, for example, in Miami, I have my Miami referral who does outside monitoring for me for the patient. And then when it gets closer to the egg retrieval, they just jump on a plane and come over here. And again, for the embryo transfer. In many of the big cities, we have people that help us do this. And we also do it for other people.
Right. And you're able to transfer or you could ship the eggs frozen in a certain specific way. Or is that more risky?
I can tell you from experience, most people who are making embryos in our clinic are not moving them somewhere else to transfer.
Right. They're just going to stay. Another question is, so you basically do the ERA with everybody. That's just like your protocol.
I offer it to everybody. If someone has like 8 or 9 embryos that are genetically normal, there's really no reason to do.
Right. And then, because just they're going to have more chances to get pregnant.
If it doesn't work, we can always discuss it after that. It's not like they only have one embryo and everything's on that one embryo.
Right. Another question I had is, what do you think about uterine scratching or endometrial scratching?
Well, endometrial scratching, which is also known as an endometrial biopsy, is exactly what is involved with the ERA. It's an endometrial biopsy. We actually collect the tissue and send it into the ERA vial that goes to the ERA testing. And then the rest of the tissue that was collected goes into an EMB endometrial biopsy container to give us reading on endometritis or anything else. So I believe, and I've always believed, that the endometrial scratch or that damage that you're doing to the lining, the next month doing the repair process, it has a much, much, much higher chance of implantation, and I completely believe in it.
Oh, wow. That's great to know. What about, and this is something that I heard about and I thought it was really cool, but then I heard it's not really been used as much, which is co-culture, where they use the cells from the endometrium
Yes.
to grow
There's two
embryos.
kinds of co-culture.
Uh-huh.
One co-culture is endometrial co-culture, when you have to take the lining of the uterus from the month before at a certain time of the month and then put it into the dish where
Mm-hmm.
the embryos are growing to make it feel more at home.
Mm-hmm.
We don't do that so much, and we do something called follicular fluid co-culture, where when we take the eggs out and suction the eggs out, we take a little bit of the fluid that came with the eggs and we leave it in the dish where the embryos are being created, and that's co-culture with follicular fluid. It makes
Mm-hmm.
the eggs feel more at home because a little bit of that fluid is there, and we do that for many people.
Okay, so that basically, just for people to understand, it's when the follicles before they release the egg, there's fluid around it, and so you save that fluid.
So it's the fluid that's inside the follicle. So
Right.
there's a little egg attached to the wall of the follicle, and then all the fluid. You take the fluid from around, and a little bit of that is what you put in.
Right. And then you've seen good results with that.
We have. Yes, we do. We believe that it helps.
Awesome. Anything else? Is there another add-on? What do you think of endometrial glue, or not endometrial glue? Don't they have embryo glue?
We don't use embryo glue.
Okay, I have heard of that. So
I've
is that
heard of it
something?
too.
Uh-huh.
There was studies that I saw, and it made no difference whatsoever.
It doesn't. Okay, so
No.
that's a waste of money. It's good for me to know, so I can guide my patients. But
Right.
that's not something that you even have seen any benefits from.
It's been a long time since I've heard of anyone using the embryo glue. Now, there are different fluids and mediums that an embryo is placed in before the transfer. I don't know if you want to call that embryo glue. They are nutrients that help for implantation.
Mm-hmm.
But the embryo glue idea from the past, I don't think really works.
Okay, got it. No, it's good to know. I mean, there's a lot of people listening right now that are going through this process, and this is really good information for them and for me too, so I can tell my patients. Is there anything else that you're really excited about? Anything new?
Yeah, we're doing a lot of single embryo transfers where our complication rates with twins is going down.
Mm-hmm.
Thank God we're just doing really well with frozen embryo transfers and timing everything perfect with the ERA. We're doing the genetic testing on like 99% of our patients do the genetic test on their embryos. Our success rates have hit as high as 84%
That's
in a month
amazing.
because we're using these genetically normal embryos and every test we can do on the lining. So I think combination of all these little things really begins to add up. My friends that have fertility labs, some of them thought it's funny that we have like an air filtration system in our IVF lab.
Mm-hmm.
We don't use UV light in our IVF lab. All of our countertops are temperature controlled. So when you put the Petri dish down and the countertop on a winter day is cold, it doesn't give a shock to the embryo. It's basically, temperature controlled the same the year round.
That's
And
amazing.
humidity levels are controlled. So all of these things, little by little, we believe really affect everything.
Yeah, I bet. I mean, really, we are such a part of our environment. Any type of small life is going to be
Yes.
responsive to that.
Yes.
Yeah, absolutely. That is really cool. I mean, very exciting. I'm sure I'm going to have like a lot of questions as soon as we hang up because that's always how it is. Definitely interesting. What I did want to ask you about is I do see, I guess it's not, I haven't seen a great success rates with IUI. Are there special ways to approach that other people
I got to
don't?
tell you, I agree very much. We definitely get successes from IUI, but the successes of IUIs are so low that it really needs to be explained well to a patient, especially to a patient that's like 38 and is on the phone and says, I want to have like at least 2 kids. If you let her get pregnant at 38, the next time she comes back at like 40, 41, 42, the chance, if she's already having difficulty at 38, at those ages, going to get even harder.
Right.
So it's very challenging. I'm not a huge fan of Clomid. I don't usually do it maximum if someone pushes it to 3 cycles.
Why is that?
And I have people coming to me from other clinics where they did like 12 months of Clomid.
Wow, that's not good. Actually, it can cause cancer.
It's not, well, that study that was done years ago was proven to not be accurate at all. But still, even forget the cancer aspect of it, studies have shown that after 3 months of IUIs with Clomid, the success rate drops significantly your chances of being pregnant.
What are your thoughts of letrozole?
To me, letrozole and Clomid are very similar, and I
Right.
just don't think either have great success rates.
Right. Oh, good to know. So this is great. Such good information. I definitely learned a lot myself, and I'm definitely going to be suggesting some humor after transfers. I feel
That's
like
my favorite part.
Yeah, the humor is the best. So cool. How can people find you if they're interested in working with you?
So our clinic is Southern California Reproductive Center, and our website is scrcivf.com. Many people follow my social media channels, which is Dr. Shahin Ghadir, and that's DrShahinGhadir. Please follow the verified page. Unfortunately, over the years, some people have made some fake pages. We're not sure why, but they have. So it's the Dr. Shahin Ghadir page. Our clinic has a social media page that's excellent as well. It's SCRC IVF. Both are on Instagram and Facebook. And we also have patient educational events through SCRC that you can go to our website and sign up for. They're about 1 every 2 weeks, and they're free, they're excellent, and they're very educational.
That's great. I'll definitely get all those from you, and I'll be putting that in the episode page so people can have access.
Wonderful.
Yeah,
Wonderful.
and thank you so much for coming on. It was such a pleasure having you.
Thank you so much for having me, Michelle. Thank you very much.